that there was about to be 50 million taxpayer dollars that went out the door to fund condoms in Gaza. That is a preposterous waste of taxpayer money.
Condoms for Hamas, 50 million. And you know what's happened to them? They've used them as a method of making bombs. How about that?
But the Gaza the Trump administration was talking about wasn't the Gaza they thought it was.
There's a province of Mozambique called Gaza. Mozambique has some of the highest rates of preventable HIV deaths per population in any country in the world.
And the $50 million President Trump mentioned were in fact earmarked for HIV programs in Mozambique. The claim came from DOGE, the Department of Government Efficiency, led by Elon Musk, the world's richest man. It was tasked with bringing down U.S. government spending. Citing Gaza as evidence, it suspended most U.S. foreign aid. We went to the other Gaza to find out what happens when life-saving aid is abruptly cut off. "6,000 kilometers from the Gaza Strip is Gaza Province in Mozambique. The country is facing one of the worst HIV epidemics in the world. More than 2 million people are infected. Here in Gaza, almost 1 in 4 adults live with the virus. Zaida used to manage one of the largest HIV programs in the province until January 2025.
Sinto muito, porque o fecho deste projeto foi uma coisa muito rápida. Foi daqui para aqui. Chegamos aqui, disseram que hoje devem parar de trabalhar. E não seguiram os nossos direitos de indenização, até hoje ainda não disseram nada. Então, quando vejo o portão, mesmo passar pela estrada, vejo o local onde desgraçou muitas famílias.
Her NGO, Oxida, ran a network of 500 health workers. They supported 140,000 families affected by HIV. But with the stroke of a pen in Washington, all that ground to a halt.
O que está a se identificar nos últimos meses é a subida de carga viral em algumas ondas sanitárias. E a carga viral sobe, porque se a criança não toma o medicamento na hora certa, e falta algumas consultas de toma de comprimidos a hora. Não, pessoas idosas, às vezes não conseguem marcar a hora. E nos dias de controle.
Mozambique relies heavily on the U.S. to fund its health system. 70% of the country's HIV response was funded by PEPFAR and delivered by USAID. These agencies paid for doctors and nurses, medicines, and community outreach programs.
The MAGA movement,
But during Donald Trump's second election campaign, USAID became a target of mainstream conservatives and the focus of conspiracy theories.
In 2014, USAID was busted running a covert operation where, according to their own people who were involved in the operation, they set up an HIV prevention program in foreign countries because it would be the perfect excuse, because counterintelligence would never think that the HIV clinics were the place that they were using as key nodes in the regime change network. How many other
Mike Benz's claims were baseless, but that didn't stop Elon Musk from amplifying them on his social media platform X. He wrote, "USAID is a criminal organization. Time for it to die." And when Trump was elected, he granted Musk the power to kill it.
And to that end, I have created the brand new Department of Government Efficiency, DOGE, which is headed by Elon Musk, who is in the gallery tonight.
USAID was among the first on the chopping block. Musk wrote, "We spent the weekend feeding USAID into the wood chipper. Could have gone to some great parties, did that instead." By early February 2025, most of its operations were suspended.
USAID! USAID! USAID!
While aid workers were protesting in the US, the effect was soon felt in Mozambique.
A polícia dia 30 de abril lembrou.
Racina's husband Pelagia had HIV. When health workers from Oxida lost their jobs, he lost access to vital care.
Iko anga kumekudla leswaku kuma mali kuma suma vitamina para ta kuma ko avena ntamlo kwa pesa makele. Ni wanga ate. Anesti so sinimisiwe yini. Anesti. Ani bona ngale kahle a kwalala ntamu angati be atlhakile. Kumekale frago kola ka ku ana fata kudla ngati be se a kumeka makeni na mampesa.
So simples não tomar corretamente, ter carga viral elevada. O morrer não é só não tomar, não ter frasco de comprimido. Não é suficiente. Em termos de comprimido, não é suficiente. Então tem que conjugar essas coisas. É o comprimido, a consciencialização e a alimentação. Porque a pessoa pode tomar todos os dias medicamentos. Se tem problemas de alimentação, não vai sobreviver.
Without food and support, Pelagia's health rapidly spiraled downwards.
Nikamani ku ayifamba esibhedlela. Ifamba esibhedlela. Ufika bayinikana namakomprimedo. Igama ayibuye. Shendangiswa ndanyana. Uso sitatuara na usiku. Situara na usiku. Sagama faliseka.
Racina and her daughter are also living with the virus. The family has lost its breadwinner. So food is even more scarce. Without help from Oxida, Racina can barely scrape together the family's only meal of the day. And her case is just one of many. In 2024, 2 million Mozambicans were on HIV treatment, which was available in 97% of health facilities countrywide.
Then came January 2025.
At the 2025 International AIDS Society Conference, the impact was borne out in numbers. Data shows the number of people starting HIV treatment fell immediately.
For treatment initiation, there was a 14% decrease from February to May 2025 compared to the same period in 2024.
And hundreds of thousands had their existing treatment either cut off or limited.
We observed a 39% increase in the number of clients interrupting treatment from April to May 2025.
As a result, about a third of those tested showed a resurgence of the virus.
Regarding viral load cascade, in adults, there was a reduction of 38% in tests performed, 37% in tests received, and 33% in results showing viral suppression.
Globally, according to researchers from Boston University, almost 160,000 adults and 17,000 children died due to the withdrawal of HIV/AIDS treatment. And that's just in the first 12 months.
Acho que eles não entendem que a pessoa, o concorte, direto ou indiretamente, pode afetar e causar morte nas pessoas. Como criança, temos crianças chefiadas famílias chefiadas por crianças, porque o pai e a mãe morreram por causa de HIV. Às vezes encontra uma criança de 14 anos, está a cuidar dos seus irmãos de 12, 9. Não, esse sempre vai precisar de apoio.
We should stop that.
Back in February 2025, Elon Musk had been confronted about his false Gaza claims.
Mr. Musk, you said on X that an example of fraud that you have cited was $50 million of condoms was sent to Gaza. But after fact-check this, apparently Gaza in Mozambique, and the program was to protect them against HIV. So can you correct the statements? It wasn't sent to Hamas, actually. It was sent to Mozambique, which makes sense why condoms was sent there.
Yeah.
And how can we make sure that all the statements that you said were correct, so we can trust what you say?
Well, first of all, some of the things that I say will be incorrect and should be corrected. So nobody's going to...
When they made these outrageous claims, they were immediately corrected with evidence and information about what they were actually investing in, which was life-saving provision of prevention for one of the hardest hit provinces in Mozambique and one of the hardest hit populations in the world.
But DOGE didn't change course. Gaza isn't the only region hit hard by the dismantling of USAID. We travel north to Sofala province, poorer, more rural, and further from the support of the country's capital. It's the evening before World AIDS Day, and Virgilio is preparing for a candlelit vigil.
We're marching and lighting the candles for the memory and paying tribute for those who exactly passed away because of the HIV/AIDS. Some of us have lost our family members, our siblings, due to the disease.
And he's mourning his organization too. Commusanas is in charge of HIV programs here.
We firstly received the stop work orders. That was 27 January. The day became dark for all of us. All of us were shocked, like sending more than 55 staff members home.
%90 of their programs have now stopped.
This was the worst moment that we have ever lived before as an organization. One of our activists that soon he had the information about the cut of the funds or the stop orders, he soon suicided himself.
Children were at the forefront of their work.
As you can see here, this project was working with the children from 0 to 17 years, and in which about 10,000 they were HIV positive. We really find the children that they were no longer taking the treatment, the ARV treatments. We really find the caregivers that they were no longer following with their children to make sure that continue with the ARV treatment. In other districts, we also had about the children that passed away and some caregivers. Really feel sad because we are no longer having this capacity to continually support them.
We showed him a video of the man behind the cuts.
Would they even try to come up with a show orphan, meaning like this sort of like, well, can we at least see a few kids? Like, where are they? If they're in trouble, we'd like to talk to them and talk to their caregivers, and then we get nothing as a response because it's what we find is an enormous amount of fraud and graft.
That's not true. We are receiving the reports of the children that passed away, of the caregivers that were no longer able to support their children. Many other cases of deaths that we have been hearing.
Caesar worked with Virgilio for years. He's still haunted by the case of Luisa, a 13-year-old girl. Her mother remembers how she found out they were both HIV positive during a routine medical check.
Unanga toda kutesta no mwana podi ndonanga itanyi uita testo ja mwana uya tese topera dini ukandika tese tiri usha tapera kwa fetariki unanga munoda ukompiri tunanga tinoda tingalamba ukompiri ngeni asikomisa atopeka jo kompimido sha kufungu homa uwa kone no kwa kompimido tokomisa yuko.
But then Luisa developed a fever.
Indate mu Janeiro tupinda bashari hapa tebela opera no utopera hivese otonangana ngavicha china kula hivi simuda gara motogara mudi ugara mototora mwana upinda kani nokona nanga vetu peto pia kwa falsi ruano dem.
Até chegou certo tempo tinha carga grande detectável, mas por corte acabou obtando, porque passou por cirurgias que eram tarde. É mais um sonho interrompido. Ela poderia ter uma vida ainda aí.
Mozambique's public health system is barely hanging on. This is the second largest hospital in the province. The system is crumbling, and patients have to queue for hours. Dr. Nelson Mambo visits Ricardo, one of his most critical patients.
Além de ter a infecção por HIV, ele apresenta uma co-infecção por tuberculose. Também apresenta uma desnutrição aguda grave. É um paciente que está num estado grave. Totalmente perdeu o tecido adiposo, praticamente só ficou com.
Ricardo's wife says his health went downhill quickly.
Como mitombwe kwenda kwatu sina kwa hospitali. Agora kwenda kwa hospitali safunika na ngone kaja. Tudo alvete kumbi neka tomata nguti takuja ila ngai. Awe neka vile vinakula kusokuti kwa komplimento au neka tomata. Agora kuna komplimento zile kusia na manongwa ja sauda neka famba bota. Tamwa neka komplimento.
In the morning, Siada takes homemade food for her husband. But Ricardo's too weak to feed himself. The doctor is seeing many more patients with illnesses related to HIV.
Se, por exemplo, tenho 6 doentes internados, às vezes 4 são. Praticamente tem a ver, porque no momento em que tínhamos ativistas ativos na comunidade, geralmente esses casos tínhamos ainda a tempo. Mas o paciente foi levando muito tempo, não vinha e ninguém podia mais ir fazer a busca desses pacientes perdidos. Então a família só traz o doente quando vê que a situação já está muito grave. ninguém faz a busca. E eles chegam aqui no hospital, e quando chegam aqui no hospital, num estado muito mais avançado, que já não é possível fazer muita coisa, acabam sendo óbitos.
And there are barely enough staff left to care for them. Many workers in the public healthcare system are funded by international aid agencies. And around 20,000 were let go when the money from USAID stopped.
Para cobrir todas as portas de atendimento. Então a saída dos colegas acaba sobrecarregando muito mais os nossos colegas de sistema. Por exemplo, se em média um técnico tem que atender 15 a 20 doentes, acaba atendendo mais. E aí logo o que chamam de qualidade de atendimento começa a baixar.
Even though he's no longer being paid, Caesar helps Siada to navigate the hospital's bureaucracy.
Eu permaneço a trabalhar pelas vidas. E eu faço isso pelo amor, não porque é obrigação. Porque se fosse uma obrigação, nem voltaria. E não faz nenhum sentido eu ter alguma coisa para ajudar alguém que não envolve valor monetário.
With hundreds of cases still unaccounted for, his work won't end anytime soon.
Estamos numa fase em que estamos a fazer resgate mesmo nessas famílias, mas tem muitos casos. Tem. Até quando nós começamos, tinha algumas crianças que internaram. Então, ainda tem muitos casos que nós estamos a fazer segmento. Porque nós estávamos a fazer segmento porque a contagem a partir de mim é individual. Tipo, em crianças que entraram, que identificamos a família, ou o pai que identificamos a família. Mas o número de crianças, desde que paramos, subiu para 100 ou 180. 180 chega. 100 a 180 nesse intervalo.
Offering a measure of hope, the US and Mozambique signed a bilateral health agreement in December 2025. It's part of the Trump administration's new America First global health policy. But critics say it's a big step backwards.
The 5-year funding envelope contains sharp cuts across HIV, tuberculosis, malaria, maternal and child health, all of the key causes of preventable suffering and death in the country. And unfortunately, the Mozambican government has countersigned it.
Details are scarce, but under the agreement, the government of Mozambique is expected to sharply increase its spending on health.
What I've learned from Mozambicans on the front lines is that they are desperate for the Mozambican government and the ruling party to step up and deliver on its commitments. Unfortunately, that hasn't happened. What instead has been seen is broken promises when it comes to contributing sufficient funds to the health sector, corruption, lack of accountability.
Before January 2025, Mozambique was moving toward a future where HIV was no longer a death sentence. It was projected that by 2030, treatment would be close to universal for anyone with the virus. Today, that future looks out of reach.
A situação é bastante lamentável, né? Porque são pessoas que vulneráveis. O seu apoio não aparecer mais. Eu acredito que daqui a 10 anos, ou daqui a 5 anos, muitas pessoas, ou a infecção vai ser maior, e ainda vão ser nascidas crianças positivas. Haverá infecção, pode haver mortalidade.